We discovered that about a quarter of our children died before their 5th birthday. And we also knew that half of them died from diarrhea, 252 per thousand. And we felt that we needed to do something about that. But BRAC was still a small organization at that time. We had about 300 people. We decided that since BRAC was the kind of organization which knows how to go to rural areas and how to transmit information and transmit knowledge, the best thing would be to go and teach every person, every one woman in every household, how to make oral rehydration fluid at home. If they could do that at home, then they will not be dependent on my marketed product which will cost them something. So initially we thought that we should first test it. So the first 30,000 households were done, and we sent out a monitoring team. We found only 6% of the households were using oral rehydration therapy. We found out that some of the oral rehydration workers themselves were not using oral rehydration for when they had diarrhea. They went to rural pharmacies and bought drugs which sort of stops diarrhea, which is dangerous actually. So we brought all our oral rehydration workers back to basically teach them exactly how oral rehydration worked in the body. So once they were convinced that their teaching improved, then we did another monitoring for the next 30,000 households which were taught. And we found that it went up to 18%. Then, of course, we fielded our research team. They found out that most women who didn't use oral rehydration told them that our husbands, our men in the households, don't like it. Since our entire program was focused on teaching women, we had completely ignored men in the households. So after that, of course, our program also included meetings with men. And also we went into mosques, village markets. So that seemed to have worked quite well. But how do we know that the women who are transmitting this knowledge is doing it properly? If it is not properly done, and women were making solutions which were too much salt, it could be dangerous for the child. So we decided that we would break down the knowledge transmission to 10 points. We'll pay our oral rehydration worker on the basis of retention of knowledge and the quality of oral rehydration solution made by the woman. So 1 month after the women taught these households, a group of monitors will go in and check 10% of the households as to how many of the 10 points that they remembered and whether they can make the oral rehydration solution. The solution made by the woman would be taken to a laboratory and tested. So that improved quality dramatically. But then how do we know that the monitors who are monitoring them were doing the right thing? So we devised a system. We wanted our oral rehydration worker to write down the name of the youngest member of the household that they visited. And that information was not available to the monitor, the youngest person's name. And then that part of it was taken care of. The monitors ensured that they went to the household, found out the name of the youngest person in the household. We always matched that. So that created a very high quality program. And then initially we covered 1/4 of the household, first 3 years, and then the next 3 years, another quarter of the household. And then the last 4 years, we took up the rest of the country. When we were doing the last half of the country, the government took up the immunization program for the country, expanded program of immunization. So we took up the half of the country. Immunization program was added to our oral rehydration program. Our programs on oral rehydration and immunization had a big impact on infant mortality reduction. From 252 per thousand child deaths, now the under 5 deaths has come down to 75, in fact. It's better than India's under 5 mortality rate. So this immunization program and oral rehydration, which took us to every household in Bangladesh, gave us the confidence that we could in fact cover the entire country with whatever program we started. Before that, we were such kind of projects in different locations, and we thought that if we did very well, it will be replicated by government or somebody else, some other entities. But then we came to the conclusion that nobody is going to replicate us. It's us who is going to replicate ourselves. So whether it is in health or education or microfinance or agricultural development, we were confident that we could do it throughout the country. We also needed to develop the capacity within the organization to be able to train large numbers of people. So we have now 14 training centers. I felt that we couldn't have gone into 35,000 schools if we didn't have the training facilities first built up. The teachers are village women, high school education. We provide 15 days of training initially, and then we deploy them in teaching a class. But then we provide 2 visits every week by a supervisor who goes and checks her. So every 10 teachers, we have 1 supervisor. And then once a month, we get them in for a refresher course, 1 day. We find that most of the teachers that we have do far better than normal primary school teachers that the government has, who has probably more education, but then no supervision, no training. So we are quite happy with these paraprofessional teachers whom we train and deploy. In organizations such as BRAC, most of the activities are done in groups. The whole system in BRAC is developed in such a way that people have to work together to implement programs. And I think our training program in BRAC also provides the kind of skills needed to work together in groups. You also need management to manage larger numbers of people. So management development has to be done to develop young managers into taking more mature, more larger tasks. We have sent out a large numbers of our staff for training abroad into doing MAs, PhDs, and so on, postgraduate training. And we have also tried to develop NGO management and leadership training in Bangladesh. And we have an international program where others are coming from various countries to have a diploma course in Bangladesh, which we provide together with SIT, School of International Training in Vermont. And BRAC provides a diploma course in NGO management and leadership. The most important value that we try to transfer to BRAC staff is that every human being has got potential and can do a lot more things that we imagine. The poorest of the poor can do a lot more things that we are ready to give them credit for. So basically, a belief in human beings' ability to change and to act. That is the first thing that we try and inculcate. Then, of course, that all human beings are equal. Every human being is equal, whether it is man or woman, or whether it is poor or rich, whether it is educated and illiterate. Human equality is something that we try to inculcate through our training programs and also our various discussions and values that we practice.